My first question would be, since the COVID-19 outbreak, how has your state managed the situation, considering that this was not envisaged?
Okay, so thank you very much for having me, Kenny, and thank you to the Guardian Nigeria for having me. I think first things first, we started quite early, and we're grateful to God that up until this time, Cross River State still remains COVID-19 free. Our last sample came in recently, and it was still negative. Um, we are grateful to God for that. We started quite early. If you can recall, as early as the first week of January, we had set up an EOC, which is an Emergency Operations Center for COVID-19 in Cross River State. We started a lot of sensitization. We brought in medical experts, people from the military, paramilitary organizations, all the key stakeholders, and everybody was on board advising and giving some suggestions on how best we can prevent this from coming to our state. We went ahead to begin sensitization across the state in rural areas. I remember as early as January when I did a kind of jingle on coronavirus, and everybody told me, oh, look, Betta, you're taking this too far. It's not in Africa, it's not in Nigeria, it's not our thing, so you don't have to bother about it. But of course, today, it's all here with us. And unfortunately, it has taken lives, it has affected people negatively. So we did a lot of work, set up our task force. The governor inaugurated a 15-man task force. I'm sure if you recall, Cross River State was the very first state in Nigeria that started screening people who came in through its local airport. So all the visitors who came in, we screened. At that point, Nigeria was not even screening people coming in for coronavirus. And people thought we're just joking, we're taking it too far. If you can recall, too, we're one of the very first states in Nigeria that shut down its interstate borders and international borders. And we said we didn't want people coming in from other states that could come in with the virus to infect people in our state. The governor released 50 vehicles. We bought 50 vehicles, trucks, small cars, put them out at these borders to man the borders 24 hours. Commissioners were kept there to man these borders. Of course, special advisors, the community themselves, vigilante, chiefs, everybody was brought on board to man the borders and keep everywhere tight. If you can recall, we started the no mask, no movement in Nigeria. When my governor first said no mask, no movement, of course, it was highly criticized. They said the cloth mask does not give any protection to anyone. We should not tell people to wear masks. That, look, this is about just medical officers that should wear the face mask and surgical masks, because the normal mask cannot give them any protection, and we shouldn't bring those kind of policies. We should stick to what WHO and NCDC is telling us. And my governor said, no, I'm a professor of science, and I know that the mask can provide solutions and protect people from coming down with coronavirus. If you understand the basic physics, if you use a mask that is 3 layers, the outer layer, which we use the Ankara to make, the inner layer, which is the filter, and then the final layer, which is just a very comfortable fabric that would, of course, not react with your skin or make you feel uncomfortable. If you use this, imagine that one person has the virus and you have to either sneeze or cough or speak out loud. And this virus, if you know the normal physics, the velocity of travel from between one medium through a barrier to another medium, automatically once it hits on this mask, it loses velocity, it loses speed, and then there's inability for it to go out into the air space in front of it or drop to surfaces where the person is. And even if that is the case, it loses velocity to travel now through the mask of the second person to get that second person infected. This is some of the things which the governor of the state said, and they said no, he was wrong. But we're glad that the president in his own speech said Look, everybody, you must go to public places, you must wear a mask. We're glad that today, on the same PTF meeting board, they can put it as part of their podium, wear a mask. These were things we were criticized for, and we started it very early in this business of COVID-19. So a lot of work has been done. We do a lot of enforcement with over 300 beats across the states to enforce the no mask, no movement. Of course, we've been doing our sample collection. We do not have a testing center yet in Cross River, but those are some of the things we want to get in as soon as possible to start testing people in Cross River. For now, what we do, we go to the communities, we go around, we do our surveillance, we get people who might have the symptoms, and then we send their samples for tests at Irua or Ebonyi State or in Abuja. When the results comes back, we publish the results and we tell people you're negative, you can go ahead with your life. So for now, we've not had any positive case. We'll continue to shut out because we're not shutting down our state. We have said there's a curfew from 6 to 8. No public gathering is allowed in our state. There's no wedding, no burial, no public gathering. Even when workers go to work, they are not allowed to hold any event, no meeting, nothing is going on in our state. We keep to the rules. All public places must have at least a bucket with a tap and soap where people can wash their hands before coming in, and you cannot allow anyone into your facility who is not wearing a mask. So we take that very seriously in Customer State, and thus far it has paid off. It's been very helpful, and our states have not recorded any case of COVID-19, all thanks to God, the governor of Cross River State, and the good people of Cross River State.
Thank you very much, Commissioner. So,
you're welcome.
The measures have been put in place, I understand that. So how would you describe the federal government's response to the COVID-19 pandemic in Nigeria? Is the federal government doing enough? How would you describe what the federal government is doing as regards the response needed for this kind of pandemic?
Okay, so first and foremost, I would want to say well done for the much they have been able to do. However, it has not been very, very easy with states. I'm the vice president of, or the vice chairman of the Forum of Commissioners for Health across Nigeria. And I can tell you with all sincerity that most states have not received any support from the federal government. In most cases, all they have gotten is probably somebody coming to give technical support. The PPEs, maybe 200 will be sent to a state. My state, it was 200 PPEs, 4 boots, rubber boots, 4 body bags of stuff, which is very, very inadequate for the state. Of course, you can't even basically do anything for that state. And we have been calling on the federal government to say, let's decentralize the response. It's time to go all out and help states. Go out, reach out to them as much as possible and help them. States are in their need. You hear people saying in states, we don't have sample kits, we don't have this. My colleagues will call me, Betta, do you have some? Can you tell? And it's a problem. It's a huge problem. There are no face masks, there are issues left, right, and center, and they're calling for help. For me, it's a call for action. We believe that the federal government is trying and they can do lots more. The cases that are being found are not found at the federal level. There's no management of case at that level. The case management is at the state level. So states should be treated on need basis and supported on a case-by-case basis. Of course, you've seen videos of people break out of isolation centers to say There have not been any doctor come here. We've not had drugs to treat. Nobody has come to attend to them. That's how difficult it is for states. I call my colleagues, I speak to them on a day-to-day basis, and there's none of them that has said, oh, we are really happy, we've had enough support and all of that. None. It shouldn't be the case. And remember that
Yes.
even the IGR generated in the states have dropped. Because of the COVID-19, people are not going out. You can't generate IGR. States, very little is coming in from federal allocation. So states are going through a whole lot. So if there are donations at that level, it will be fair enough to see how best they can help states. But at this point, I want to thank the CACOVID, which is the coalition of private sector that have been trying to help some states, because I have colleagues that have come up to tell me that, look, CACOVID has come to my state to do this, they've come to do that. And it's very, very impressive. Also, some banks have stepped up to the occasion to say, okay, we will help you. Like in my state, we've only had donations from State Bank and UBA. No other help. Everything you see from start to finish has been the Cross River State government doing it, which it should not be that situation.
Okay. So I want to ask a question about the NCDC. Do you think it would have been appropriate for NCDC to release pictures or maybe footages of what is happening in their isolation centers? Because there's been a challenge of trace contact, of people not believing that COVID-19 exists in Nigeria. And there's another conspiracy around the fact that the cases they have abroad, we can see their videos, we see pictures all over the internet, but in Nigeria is just different. All we see is empty words. So, do you think it would have been appropriate for NCDC to release pictures or maybe footages of what's going on in the isolation centers?
Okay, so I would say this. People are highly stigmatized as it concerns COVID-19 in Nigeria. People are highly stigmatized. And it would not be okay for NCDC to put out people's faces and go to an isolation center and video those who are there and the rest of it, just because of local understanding in the country. What I would rather advise is that NCDC should give more analysis of what is going on. So, for instance, rather than come every day to say we have 5,000 people positive or 200 new cases or 300 new cases, a total of this has been discharged, this death number and all of that, it might be okay to be more specific. For instance, these people in this area of Abuja, these people in this area of Lagos, this is the area where we have the highest burden of the disease, so that people who live around those areas can be more cautious and know that they need to step up their level of protection for themselves and their loved ones. It will be better to have a clear analysis of what is going on. And for me, I think it's time for us to decentralize the process. Like I've said, the response should be decentralized and supports given to states. I think at this point too, we should be able to allow the antigen rapid test kits, not the antibody rapid test kits, which have low sensitivity. We should be able to allow the antigen rapid test kits that have higher sensitivity for people to use them for surveillance. If you give me 100 and let me say you give me 50 test sample collection kits, I cannot definitely use 50 sample collection kits for surveillance in a population of 4.5 million people. It's not possible. I can't do massive surveillance. The surveillance I can only do is for people to go around and check for people who have the signs and symptoms, and then we test those people. You understand me? So it's better for them to bring in the antigen test kits. For me right now, what should be happening is a research to say, okay, if we have tested 1,000 people today using the PCR, or that's the GeneXpert machines, PCR testing, we should still use the antigen test kits to test that 1,000 samples too. In the antigen test kits, how many of these samples tested positive? That's comparing it to the number of the PCR testing that tested positive. Do you understand? That way, you can be able to say, okay, for the PCR, out of 1,000 samples collected today, 50 samples tested positive. Using the same samples for the antigen test kits, out of 1,000 samples collected today, the same 50 samples tested positive using the antigen rapid test kit, or 45 samples tested positive using the antigen rapid test kit. So states can use that, and then if you have this test done and they test positive, you can now take samples and send to the lab so that we can do confirmatory tests for using the PCR. Just like HIV, we need to decentralize the process, because too soon, whether we like it or not, we will not be able to test in those number of labs. In Nigeria, we have just about 15 labs that are doing testing. Some of them don't even have the test kits to test. The cartridges may not be enough and all of that. Sometimes they are on, sometimes they are off. There was a time in Kano where for 5 days testing did not hold. Meanwhile, people were dying in their numbers and they couldn't tell whether it was COVID-19 or not. So it's something that you look at it critically and say, look, let us check on both sides to say, how best can this happen? If it can happen that way, then we decentralize the process. And let the testing for COVID-19 be like testing for malaria, be like testing for HIV, be like testing for every other thing. You allow people just to test. And then that way, you can easily have on-the-go, real-time results that can help health workers make more informed decisions. Already as we speak, over 140 health workers in Nigeria have already tested positive. And this trend will continue to rise if nothing is done drastically about it. So these are just simple suggestions we're putting forward to the federal government to see how they can further decentralize the process and make it more effective.
So the decentralizing the process is important to be more effective and efficient.
Yes.
Thank you so much. We've been talking to the Commissioner of Health in Cross River State, Dr. Betta Edu, and she's giving us some really important notes around the COVID-19 pandemic. Okay, so my next question will be about the tracing still, but you already pointed that stigmatization is a major problem as far as Africa is concerned due to our orientation and beliefs. Okay. The government for a while. Do you think some governments have alleged that there's political?
Sorry, I can't hear you.
Some state governments have alleged that there is a political manipulation going on with this epidemic. Does your state have the same sentiments that some states are getting more attention than others?
Well, you can't leave politics out of everything. You can't leave politics out of anything. That's the truth, whether we like to hear it or not. That's the honest truth. There's politics in everything, So it's okay to understand why some states will get help and some won't get, even when they have very serious issues, or they might not get as much help as they need. As we speak to you, I can tell you very clearly that Cross River State has not received any help from the federal government thus far. We are still hopeful and we're expectant that help will come based on the need which we have as a state. Like I used to say, it's something that should be a thing of pride to the federal government to say, okay, there are still states in Nigeria that have not been affected. You're the Nigerian Center for Disease Control, so you should be able to control it. I remember the pride with which the Chinese person who sits like a minister for health said in China we had the disease. It started in Wuhan. And there were provinces in China that never got the virus. With all the deaths recorded, with all the number of people who came down with the virus, there were some provinces that did not have any recorded case in China. So it's going to be so unfair for one to say every state must have. Your pride should be that every state did not have, were able to control it. So for a state like Cross River, the discussion should not be how should we help you get 500 ventilators. Actually, in the whole of Nigeria, I'm not sure they've used up to 4 ventilators in Nigeria so far. The discussion should not be how can we help you get 1,000 bed space. That should not be the discussion. Fine, we have all of those. We have over 120 bed space in Nigeria, in Cross River. But the discussion should be how can we help you prevent? You're bordering Cameroon on this side. You'll be struggling on your own to put security and people to man those places. How can we help you as federal government? How can we help you? Of course, we really thank the president for his help, because the speech where he said all interstate borders should be shut down went a long way to help us to reduce the pressure. Those are the kind of things we want to see from the federal government to our state. We are trying to prevent. We are the pre-COVID state. So you should treat us as pre-COVID, not as people who are in the COVID stage. And that's the same way all the states in Nigeria should be treated. For everything, of course, there must be politics in it. There must be, whether we want to say it loud or we don't want to say it, there must be politics in it. But we want to believe that the interest of Nigerians is still topmost to Mr. President. We want to believe that the interest of Nigerians is still topmost to the minister and the NCDC boss. And we believe that what is being done is in the best interest of Nigerians. We are only suggesting and advising that they decentralize the process. Patients are being managed at the state level, and so they should help states to be able to manage patients more. We should not be seeing things like what is seen in Gombe and the rest of them, where people have to go bust out of isolation centers, go to the streets and say for 1 month, no food, no drugs, nothing. They should come out and help states. Please, I can't more passionately say this. It's not about my state alone. It's not about myself alone, but it's about our people, our joint interest as a nation. We need to be able to do something more drastic to help people. And we need to be able to reduce this number, flatten this curve, and of course, reduce the number of people who are dying in Nigeria.
Thank you so much, ma'am. So my next point of discussion will be around the letter that was written to the president by the Ethnic Leadership Foundation. Are you aware that the letter was written by the Ethnic Leadership Foundation on April 30th, alleging the Cross River State government? They are alleging the Cross River State government of rejecting COVID-19.
Okay, so I didn't know about it, but I was informed later on, and it was one of the most very funny and ridiculous things I have read in recent times. First and foremost, the person who is writing it doesn't live in Nigeria, doesn't live in Cross River State. He does not represent the ethics in any way. The ethics have written a disclaimer to that. He doesn't represent them. He's just somebody who is living in whether Ireland or somewhere like that, who sits down, gets his opinion formed in his head, and writes whatever he wants to write and share around. He's not on ground. He doesn't know what's going on. And I don't blame him for writing whatever he's writing. And I'm very happy that the federal government took that with a pinch of salt, and no attention has been given to that. I have refused to respond to it because it's not what the discussion in whatever way. It's just someone just blabbing and just trying to be fictitious about things, cooking up things that don't exist in his comfort somewhere outside the country. If you want to fight COVID-19, you come to the front line. You come back to Nigeria, come to the States, and see what is going on. And that way you can address issues. You can sit down nowhere and write about things you know nothing about. But I'm glad that the people who he claimed to represent came out clearly to say that was not in any way their representation. We met with the Obama of Calabar, and he was impressed with what we were doing. Of course, he was one of the people that have been doing even the rural area sensitization. He's the first class chief in Nigeria. He's the first class traditional ruler. He's a king and is highly respected. He's the head of the ethnic nation. And we met with him. He was happy with the response from Kashmir State government. And of course, he told us all the beautiful things he has been doing. He called the chiefs, all the chiefs under him across the various local governments, spoke to them, instructed them. He also ensured that the palliatives that were given through the chiefs got down to the grassroots. He engages with those at the grassroots, and he's a wonderful person. And he was able to come forward to say, look, we're going to work with the Kashmir State government to see that the message gets down to the grassroots. Indeed, he's a leader, he's an exceptional leader, and we commend him for that. So those people don't represent in any way the ethics or anything like that. This is just someone who is sitting in his house somewhere outside the country, writing whatever his fictitious mind can tell him, and really have decided not to respond to it. And the government is, of course, we don't deal with things like that, yeah.
So there was a video that went viral.
Sorry, I can't hear you.
I said there was a video that went viral.
Okay.
First briefing you did. You said, in quote, "It is not compulsory that every state in Nigeria should have a COVID case. People have gone to meet the team to text messages that has been sent to them that if they say they are COVID-19 positive, then they will be given millions of naira." End of quote. Now, some people have come out to also say that when you were saying this at the press, when you said that at the press briefing, some thought it was hypocritical, not involving the police, and assumed you did not investigate. What steps did you take when you heard the text messages?
Oh, sorry. It's funny to hear that. I'm sure the people should be able to ask me first, what did you do? So first and foremost, it was very, very disturbing for us as a state and as a people when we heard the NCDC boss say that all the states in Nigeria would have COVID-19. And I thought, no. This was out of place. Something was wrong somewhere. You need to be controlling and protecting and helping states to avoid having COVID-19. I remember in one of the PTFs, the Minister for Health said, in fact, I think it was at one of our meetings, the Minister for Health said, we want to try to see that those states that have not got any case should, and that was very encouraging. And that's really where we should be headed. Keeping states COVID-19 free, not saying every state would have or must have. That's number one. And it was very disturbing for us. And I thought it was time that we correct that impression. Kept getting calls. I kept getting calls every day. Look, you're not doing enough. You're not doing enough. You're not doing enough. That's why we don't have a case. And I said, no. You wrote out the criteria as NCDC. You wrote the criteria out. And you sent them out. And states are standing by your criteria. I have a direct email from you stating that when we see persons who have headache, who have fever, who have sore throat, difficulty in breathing, and all of that, then we should have a high index of suspicion. We should take samples and we should send to you. And everybody who has had that, we've taken their samples and we've sent to you. What else are we supposed to do? Cook up the people or do what? What really are we supposed to do? That's one. Secondly, in my state, I think once or twice people had walked in to meet the task force to say, see this text message. I think one person had come into my office before to say, this text message was sent to me. Of course, immediately with the crowd and pressure on me, we discarded the person. We said, no, please. Discarded the message. We said, no, please. Just ignore it. It's a case of fraudsters, because we have even received pictures of letters that have been written by people to bodies asking them to support Cross River State for the COVID-19 fight. And this is the account to pay the money into. And it's a personal account with a personal number. I have those evidence on my phone. And we've even seen people, of course, they come and say, no, please just ignore that. Nobody ever gets paid for saying I'm COVID-19 positive. In fact, somebody said, I think it was on Correct FM, when we had, they had me online on a show, and somebody called in to say he got the text message and he's ready to volunteer to say he has COVID-19 on a live show. And I told him, I said, no, please, no, please. No, please. I have the recording of that show on my phone. I said, no, please. Nobody is going to pay anybody for saying you have COVID-19. Please, wherever you get those messages from, please disregard them. In fact, the one that was shown to me was a bulk SMS. You know, this bulk SMS sent out. It was on an MTN line and all of that. And I said, no, please, disregard all of those things. In fact, there was another one that was sent to me with a code number. They said, dial this code for you to, okay, you'll be paid every day. If you have COVID-19, you'll be paid 25,000 every day. Something just like that. Dial that code. Of course, we met the security agencies. We even forwarded those messages to them and everything so that they can help us with investigation. It's none of my business to investigate. Of course, I'll send it to you. When I see such, I send it across to the right quarters to help us look into it, what's going on here. So those are the messages that people in my state received. And we keep telling them, please ignore such messages. It might be from fraudsters, because it could be a situation where you pick up the message and say, okay, I'm interested. And then the next thing, the fraudster tells you, first to get the forms, you need to pay 10,000 into so and so account. And then as soon as you pay the money, that's the last time you hear from them. They've disappeared into thin air. So this could be fraudsters, scammers. They're trying to do one or two funny things. Please ignore those messages. Ignore them. You just hear people sometimes, they stay on social media, they say the right things like there's a COVID-19 positive person here at so and so place. What is the address? Where is the place? Just say there's a COVID-19 positive person in Ikom. There's a person in Calabar South. Who? Where? Whom? We send our surveillance team. They go in there, they search, they find nobody. So those are the kind of things that we've had to deal with. There's been a lot of social media influence. So there's one thing, people are misquoted. It's everyone's social media, and they make some rules out of it, and it's just funny. But in all, it's been a wonderful experience. I used to tell people I would never imagine in my lifetime that there'll be a time where I cannot travel out of my state. I cannot travel out of Nigeria for over 6 months. It sounds strange, but that's what it is. And life has really changed for indeed everyone. It's a privilege to be a commissioner for health at this point in time. It just could have been anybody else.
So we've been discussing the discussion with the Commissioner for Health in Cross State. Like I said, please feel free to drop your questions so that we can, throw it out there. Thank you so much, Dr. Betta Edu, for joining us. Thank you. That will be enough. So, my next question would be, some citizens have come out to say that they have been held by the NCDC, whatever health agency, whatever health facility is holding them down. They have been held down beyond the 14 days isolation period. They are not being allowed to go out. They can't go to their houses. They are not sure of what their test results are. So it's more of an abuse against their fundamental human rights. What are your comments on this? I don't know if you've come across any of those videos, but I've seen
Well,
a
I think
couple
it's
of them.
just one. I've seen the woman who was speaking, I think on from Benue, something like that. The woman from Benue. I think she's the only one I've heard her discussion saying she's been held hostage. She's going to bring her lawyers to sue and all of that. For me, really, I just think we should demarcate the whole issue. If you get people, test them and let them go. If they're negative, let them go. If they're positive, then you can keep them and treat them. And then when they're well, after testing them once, you let them go. If they test negative, you let them go. I don't see any reason why people should be kept in a place for over a month or 2 months. It's not necessary. They have lives to live. COVID-19 is not the end of the world. And life should go on. Really, life should go on if you ask me. So for me, what I would say is simple. If you find people who you suspect in the interest of the public, in the interest, of course, of every Nigerian, you should be able to take them into isolation. And within hours of getting to isolation, they should have their samples taken. These samples should be sent to the lab, and within 24 hours, they should have the results back to say whether they are positive or whether they are negative. Remember, if you don't do that, there's a downside to it. But that, I mean, imagine that you have to link up or put people in the same room that are both positive and negative, and you don't know. Let's say you brought in 10 people, and in those 10 persons, 2 were positive and 8 negative. If you continue to keep them without telling them their status, without testing them, without sending out, of course, their results to them on time, there's a high chance that the 2 might infect the others, which is something that you will not want. So for us, we believe that if that is the case and you are testing people or you're bringing people into isolation, take the samples, get them tested, and if they are negative, let them go back home. Those who are positive, you can keep them, treat them immediately. Once you carry out the first test and they are negative, please let them go. It's not easy to be in one room without any form of contact with your relatives, and you just sit down there and do nothing, no information whether you're positive or not, nothing. It's not easy, and then people should not be subjected to that. I believe truly it's their right. If they are negative, let them go. I wasn't happy with what I saw at different points where people have been kept in isolation, not being tested, and they're just there endlessly. For the people who came from outside the country, I believe that they should be isolated, and that was the right thing which the federal government did. That was the right thing. However, I think they should be tested and allowed to go if found negative as soon as possible. And I just hope that they are in different rooms together.
Okay. So my very last question will be your experience as a young commissioner. I envy you a lot. As a young commissioner at this time in particular, what are the leadership lessons you have learned from this health pandemic?
Okay, so a couple of things. Number one, you need patience. You need patience. You need all the doses of patience you can swallow in 10 minutes. You need all of them in your system, because people will say very terrible things about your person. People will say very terrible things about your government, about your form of response. You need to be able to withstand all this and continue to give explanation to the public, because you're a public servant and the public deserves that explanation. You need to communicate to people, because if you stop communicating, then you allow them to assume things, and they might assume the wrong things. I think you just need a lot of energy to push, and you need to be firm on your decisions, very firm. It might not all go well with everybody, it might not go down well with all, but if you are doing the right thing and you believe you're doing the right thing, you need to be firm on it. For me, age is just a number. I've always been in leadership positions, being a very young person. So I've never really seen it as an issue at any point. I respect people and people respect me. I believe if you have capacity and you bring something tangible to the table, people will respect you for what you bring to the table. I work with a governor who believes in the youth. He's given young people a lot of opportunities, and we have not failed him. The other day he said, I can only imagine if it was not a young person bearing all of this stress, burden, and pressure, of course, the person would have broken down or fallen ill by now. But we've been everywhere. We've had to sleep at borders. We've had to visit communities for surveillance. We've done a whole lot of work. And that's because we are passionate about it, and we want to do the best in the interest of our people. Like I tell them, you cannot hide COVID-19. It's like pregnancy. Somebody cannot be breathless and dying, and the person will say, no, I won't talk because I want to hide it for the state. It's not possible. What is, what isn't. We'll continue to do our best to see that we can improve on our level of preparedness. We'll continue to do our best to see that we can protect our borders and, of course, protect people. We want to thank Governor Betta Edu for all he has done for the COVID-19 response thus far. We want to plead with the federal government that it's time to come in and support Cross River State in all your might to see that we can prevent the virus. That's the right thing to do. And we want to work with every stakeholder to continue to keep our state afloat. We should be a thing of pride for Nigeria. We should be a thing of pride for Africa to say, well, there are places where it didn't get to. I read about Lesotho, a country that is just beside South Africa, and they've not recorded any case in that country. And for me, I was like, I'm so proud of them. Able to shut their borders down and prevent the virus from coming in. That's something great. I wish the country had taken that step on time to say, look, shut down the borders. I'm sure we'll not even have the first case coming from Italy into our country, and maybe. With that being said, we believe that we can be able to contain it, flatten the curve, reduce the number of new cases to zero if everybody works together. Please take the issue of wearing a nose mask and, of course, physical distancing, very important. Take the issue of washing your hands, using hand sanitizer, very important. If you see something, say something. Together as a team, a tag team, we can defeat COVID-19 in Nigeria.
Thank you so much, Dr. Betta Edu. It's been a
Thank
privilege
you.
speaking with you. At this point, I would say thank you to everyone who dropped by to check in on us and those who dropped in their comments. We appreciate your time. So, do you have any last words for us? Anything you want to say as your sign out?
Sorry, what did you say?
Yeah, I said, do you have any last words for us? Your sign out.
Okay, so I think first the federal government should support states. Secondly, I think that we should decentralize the response process and help states to do more. More states should be testing right now, and more persons should get involved at that level. I think states should be taken on a case-by-case basis. I think that people should not be kept in isolation for too long without their samples being taken and their tests told to them. I also strongly advocate that in places where they have a lot of cases, we might begin to consider community management or home management for cases, because I know the burden on isolation and keeping thousands of people in isolation is sometimes very difficult, cumbersome, and heavy on states that are not being supported. Also, I want to encourage Nigerians to use your nose masks. Take it very, very seriously. Very, very seriously. Use your nose mask, and let's be able to protect ourselves and protect others. We want to plead with Nigerians, the basic things at least: wash your hands, protect yourself, use hand sanitizer, avoid contact with people. Weddings can wait, burials can wait, public gatherings can wait. I'm sure with time things would ease out, the curve will flatten out, and we'll be able to move forward. But together, I believe if we work hard on it, we'll be able to flatten this curve, and Nigeria would be back. Even if we're not back to the pre-COVID state, we would be back to at least a situation where we'll have insignificant cases occurring and very insignificant number of persons dying from the COVID-19 outbreak.